Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Welcome back to another Smile Sisters podcast.
Yes.
What are we going to talk about today?
So I've been hearing a lot about, the conspiracy that dentists have about, doing treatment that's not necessary, like root canals and crowns and things like that.
And it can give you like all these cancers and stuff. I listened to this whole podcast about how root canals can give you cancer.
Right. So I just want to talk about, alternative options and sort of the psychology behind why dentists recommend certain things. And, we get this a lot. Someone will come into the practice and we'll recommend something and they'll be like, well, I went to 3 other places and they recommended 3 different things.
That's right.
How is that?
It's very confusing from a patient's point of view.
Yes, and it sort of makes people feel like not trusting the dental community or the dentists in general because there's so many different opinions.
Before we get into opinions, let's talk about something first, because there is I do understand why people are like that, because in a couple episodes ago we talked about our associate who went to try out at this dental office.
Yes.
And this is an HMO office, and the way HMO works, you guys, is that you get $7 per month per patient, whether the patient shows up or doesn't show up. And then you get paid $30 if they do a crown, or you get paid very little bits. And so the goal sometimes is to delay treatment. So you delay the appointments because you're getting paid monthly whether the person shows up or doesn't show up.
Right. You delay until the treatment is severe enough to require something that pays.
Exactly.
But I want to say that's not the normal typical practice.
But that's the thing, though. It's it's so confusing. That's not the normal typical practice, but some offices do these things where they recommend maybe treatment that's not needed, or they delay treatment until it's severe enough. So you have to find a good office.
Okay. So the issue is that sometimes the patient's needs are not aligned with the doctor's needs, as in the insurance dictates
that's right
what the payout is, and it has nothing to do with what's best for the patient, and it doesn't align with profitability for the dentist. You want to find a provider who has your best interest in mind, but they need to be able to get paid. So if you are on an HMO plan and it just doesn't pay your provider.
And the plans are so variable. We're not knocking all HMO plans, but the plans are little booklets and they can change monthly. So it's almost impossible to keep up with all the changes and, reimbursement schedules and stuff. And it's crazy for dentists out there to try to understand and keep up with this stuff too. It's hard.
It's intentionally, they make it intentionally very confusing for everybody involved. And there is definite, intent behind that in order to, not be clear about what they're paying. Yeah. So everyone can be kind of in the dark.
We had a situation with one of our insurance companies where they weren't paying us. We're disputing it. Finally, we win, and they had to pay us interest because it took so freaking long for them to pay us. So they sent us a check for $5 interest. The amount of time it took our team to fight that was way more than $5. So
it's not even worth crazy. It. I mean, we have somebody on our payroll that just deals with insurance payments.
Yeah.
These things get costly. Right?
Yeah. So anyways, back to
even from a clinical standpoint, so what I was hearing about is, root canals and crowns. Dentists are over-diagnosing this.
Right.
And so the public notion sometimes is, oh, they're just trying to rip us off. They're lying to us. We don't really need this. I want to say that it's not always so black and white.
It's not.
And often it has to do with what that doctor was taught in dental school. And, I teach at UCLA right now. And my goal is to teach sort of more advanced techniques, more conservative biomimetic approaches, which is all about conservation of the tooth and like do the minimal amount required, conserve the nerve, don't do a crown. Whereas, what we were classically taught and is still taught at dental schools everywhere is based on scientific research done in the 70s, which is where bonding techniques, like right now, when you get a white filling, we chemically bonded to your tooth in a way that wasn't really available or that well done back then.
Right.
So back then it was all about retention. You had to cut the tooth in order to like mechanically lock something onto it.
Right.
So that was the first thing that has changed, but still it's taught in that old way. And this just has to do with why the dental community and the scientific knowledge around it hasn't caught up, in its teaching to the students. So it's a
Once
problem.
you get out of dental school, there's really a wide world of stuff that you can learn, and people gravitate towards different aspects of it. But while you're in dental school, it's taught very old-fashioned. I want to say, like from the 70s. It hasn't changed much.
It hasn't, and unfortunately, some of the professors that teach at the dental schools they were born a long time ago. So they're, not to knock all of them. Some of them are amazing, very dedicated.
Yes.
But sometimes their approaches are kind of set back in time as well. So that is a problem. So my goal always as an instructor there is to teach the students to open their minds,
Right.
Like I'm going to tell you my opinion, but it's not the only opinion here. You ask they'll tell me like, oh, I want to treatment plan this patient's case, but I asked this professor and he said I should do it this way, and this professor said I should do it that way. I'm like, welcome to real life,
Welcome to real
now
life.
Use your brain and figure out which option makes sense to you. And so that's the reality, and that's how things are treatment planned when you go, and that's why you go to 3 different practices and maybe get 3 different treatment plans to deal with whatever dental condition that you have. And it doesn't mean that the guy who did one thing is trying to rip you off, but it all comes from a background of experience and knowledge.
Yes, and what works in each person's hands. So it's very personal sometimes, like I can get something to work whereas someone else may not, or vice versa. So it's a very much of a craft. So we're very AI resistant, I want to say, in our profession, because there's a lot of tactile and hand sensations that you have to go by as a dentist, and different people have different skill sets.
True, and there's different knowledge behind it, different materials that we use. So all of that matters. But from a biomimetic standpoint, our approach is to not do crowns and not do root canals electively. And so this has been a shift that I'm seeing more and more in the dental community.
Yes.
Which is great. But you might go in somewhere and you have a really, really big cavity that is close to the nerve in your tooth. And one dentist might recommend a root canal, then a post inside your tooth, and then a full coverage crown.
Right. And that's perfectly acceptable and within the standard of care.
It is. And I was taught that in dental school.
Yes,
if it's close to the nerve, okay, the tooth doesn't hurt, it's not bothering them, but this tooth could eventually need a root canal. So why don't you just do the root canal now and save the patient the pain down the line? Right? And so that approach is still sort of practiced everywhere. But what we are understanding is that a root canal, when it's needed, like if you already have an infection in your nerve, then the only option is to root canal it or take your tooth out, or severe pain that's in the nerve of the tooth. So sometimes it's unavoidable if we want to save the tooth. But if the infection isn't on your nerve, but it's really close to it, but you don't have any of the symptoms, then another approach is to very carefully remove the cavity, but leave a little bit of the cavity of infection right over top of the nerve.
Well, here's the shift, right? Is that leaving a bit of cavity was totally unacceptable in dental school.
Yes.
You never want to leave any cavity, but now we're understanding that if you leave a little bit on that deepest part that's on the nerve, you can protect the nerve. You can still get a good restoration, whether an onlay or filling, and the tooth can survive for years and years without needing a root canal.
Right. And now the benefit of that is a tooth that doesn't have a root canal in general is much likely to last you your lifetime in your mouth versus a tooth that does have a root canal. Right.
That's right.
So if the root canal is elective, then we're electing not to do it, right?
Yeah, we're electing against it.
Right, because those teeth are more likely to crack, to fracture. You know, you already like kind of made a hole in the middle of the tooth, so now there's just the next step is probably an extraction if that fails again. You know, more
and
likely.
now because of all this, like, I mean, this podcast, there was like a Netflix thing on it about how root canals can create cancer. There's people like opting not to do root canals at all, even when it is needed. They just take the teeth out, and that of course creates a whole other host of problems. Now you're missing teeth and bite and all this other stuff that can change. So yeah, we want to avoid root canals, but in the general dentistry world, root canals are still indicated if you're having pain or an infection. We're still recommending them.
Yes.
But yes, we do want to try to avoid them. I mean, it's not like something we want to jump to.
Exactly. But that is why there might be a disparity. I saw a patient yesterday actually in the chair. She cracked her tooth in half over the weekend or on Friday, and then she went to a dentist on Saturday who said, you need a root canal in this tooth. And then she was going to go back this week, and then she came in to see us. And I looked at it and I'm like, well, it's close to your nerve, but are you having any symptoms? I'm tapping on the tooth, I'm feeling around, everything's normal about the tooth. Yeah, it's broken in half, like she lost the bottom half of her front tooth, right? But it's not on the nerve yet. And I was telling her, well, you know, the issue is then you have to have a conversation. This tooth has had trauma to it. There's a chance at some time in your future that this tooth might need a root canal. Often with trauma, we want to reevaluate in a few months, actually, because these teeth, the nerves can die.
But not immediately, not always.
But not always, right?
Yeah.
And, but then, yes, we can go ahead and, you know, fix the chip on your tooth with a veneer, which is what we ended up doing. But we're electing not to do this root canal. But patient, you have to know that this may end up hurting down the line.
Right.
But if we don't root canal it and it doesn't hurt, it's much better for your tooth in the long term.
Absolutely.
And so having those conversations. So I know that the dentist that she went to probably had the best intentions.
Yes.
And wanted to make sure this tooth didn't start hurting her. But, you know, she chose to look somewhere else, which I totally understand and is valid.
Yeah.
But part of it is like not having these conversations with our patients and then what we've been taught.
Well, in those very busy offices where, you know, you're getting paid a little bit for each patient, you really don't have that time to sit and have a conversation
about what it means.
It all comes down to those basic things of like, how much time do you have and how many patients you have to see. And, you know, if you have to see like 30 patients in a day, there's no way you're going to sit there and explain biomimetics to them. That's just like outside of your world in those situations.
And that's why those insurances are not, again, they're not aligned with the patient's best needs and the doctor's best needs.
The insurances are aligned with the insurance's best needs.
Totally. and it creates this tension, you know, because chair time is valuable. So we were just talking about, you know, a patient coming in and saying, and having been told by the dentist, hey, you need this treatment, but also if you get this and this done at the same time, we'll give you a discount.
We'll give you a discount.
And why is that? Because our time is what...
Our time is what we get paid for.
Right.
Yes. I mean, someone asked me, why is it so expensive to get braces? I'm like, okay, here's the wires, here's the elastics.
Go ahead.
See you later. You're paying for my time. You're paying for my knowledge.
This wire only costs $20.
This wire is only like $10. Fine, here it is.
Actually, those wires and things are quite expensive as well.
But I mean, it's, you know, like that's what we get paid for is our time. So when someone comes in and it's like, oh, if you do this, we'll knock off $500 because you're already sitting there. The dentist is already there.
The setup is there.
Like,
Dentistry is a huge overhead.
Huge.
It's very expensive. All the materials, all our staff that has to be with us when we're treating patients, we need them. So if we can like add another filling in at that same visit or 2 or 3 more fillings at the same visit, then it costs us a lot. It's much more efficient. It costs us less money.
Yeah.
And it's easier on the patient. They're not having to come in so many times.
Well, yeah, some people prefer to have like shorter appointments and longer, but
Right.
But anyways, there's a lot that goes into this business, and it's not all always transparent and clear. So I guess it always comes down to finding a right provider that you trust and having a long-term relationship with that person, so you can like keep up and maintain. I think that's really the best way to keep your teeth healthy over a lifetime.
It is. Find someone who aligns with you and your needs. And often that has to mean, not going maybe with the insurance that's in network for you, because with a provider that's in network, sometimes that doesn't align.
Yeah,
sometimes
the
it does,
insurance
but it
runs.
makes it a lot harder. I mean, we are in network with still a few insurances,
for sure.
but it's definitely trying. Especially we practice things that take more time here, like biomimetics, explaining things, and when the insurance provider just doesn't pay, it makes it difficult. That's the honest truth.
It's hard.
So thanks for listening. We hope this was helpful for you to understand why dentists might treatment plan things the way that they do. Go find a provider that you trust that will spend the time to talk to you. Okay?
Okay, see you next time.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.